Good morning. Welcome to my channel. If this is your first time, I said welcome. Please don't forget to subscribe and like, comment, and I promise you I'll answer those comments. And thank you. So today's video is for those who are trying to get pregnant, who are finding it difficult to get pregnant. I have 10 tips for you that will make these pregnancy things faster for you. So my advice for a woman who is trying to get pregnant is, number one is to know your body. So number two, know how far apart your cycle are so that you can time accurately. So guys, here are my 10 tips. So number one, get off your contraceptive or whatever that you use. It can be pills, whatever that you are using for protection. So get it off as soon as possible. So the reason is that when you do this, it takes up to 3 to 6 months to reset your whole body. So thereby to regulate your hormones. So it takes a long time. That's why as soon as you get off your contraceptive, the better for you. So number two is get to know your cycle. My question to you is, how much do you know your cycle? So the reason to this is that so that you know your most fertile day. So if you get to know your cycle, this will really help you. So monitor your monthly cycle by tracking it either in a journal or a calendar. This actually helps very, very well. Number three is monitor your ovulation, because this is the best time for you to get pregnant. So women with a regular cycle ovulate about 2 weeks before the arrival of their next period. So it is hard to predict ovulation for women with irregular cycle, but I'll tell you what to do. So for women with irregular cycle, the cycle always starts about 12 to 16 days before your next period. So for women with irregular cycle, you can buy ovulation prediction kits. You can buy it at any pharmacy or anywhere. You can buy it. It's good to use it to track your cycle. That is number one. Another way you can predict it is by know your cervical mucus. So the mucus is thin and sleepy whenever you're ovulating or whenever you're most fertile. Another way, which is number four, is to have intercourse every other day. Every other day. So having intercourse every day during your ovulation time will not necessarily increase your chance of getting pregnant. I'm telling you the fact. In addition to this, during your ovulation, having intercourse every other night can really increase your chance. I'm telling you, because at the same time, just try to do it at the same time every other day. Number five is the big one, which is stress. Stress is the biggest thing. It can hinder a lot of things. Your chances of getting pregnant, your chances of getting fertile. So just try as much as you can to distress yourself. I don't know how you're going to do this, but try as much as you can. I know it's not possible because you worry so much about not getting pregnant. It has been years or something like that, but try to distress yourself. Advice for you is, the more relaxed you are, the better. Find something that you use for relaxation. So anything you plan is fine by me, as far as it's a healthy one. That's all. So my number 6, is it 6 or 7? I don't know. So know when to seek for help. I'm telling you, especially women, men, know when to go to your doctor for that infertility evaluation. So that is the most important one. Go to your doctor, evaluate yourself, know where you stand. Not staying at home and believing that miracle will come. Do you understand? Do all those necessary things and then relax. The advice I'm going to give to you, especially for my older ladies, once you are about 35 or older, please, if you try for 6 months and there's no chances of pregnancy, my dear, don't sit down. Just start seeking for help immediately, because the more you age, the more you find it difficult to conceive, because everything is declining. So before I go to my number 7, please try to check out my other video. I did a lot of video on this infertility, what to do, which vitamins to take and everything. Please check it out before I go to my number 7. My number 7 is start taking your prenatal vitamins. Don't wait until you get pregnant. Even our advice to even start taking your prenatal vitamin 3 to 6 months before you even start trying. So there's no harm, they're all vitamin. And make sure that you're taking a lot of folic acid, vitamin B's, all the B vitamins. There's a lot of them. That's why I want you to go back to my video and check all those vitamins. So it is very, very necessary to start taking your vitamins. Number 8 is eat varieties of healthy food. This will help to prepare your body for pregnancy. So eat food that is rich in calcium, iron, protein, healthy fat, or I will also advise you to seek the help of a nutritionist so that to know all those healthy food. And go easy on caffeine is also my advice for you. Do exercise, not strenuous exercise, just little by little exercises can also help you to prepare your body to this conception. My number 9 is, I don't know, people may argue about this one, is stop smoking and stop drinking. Go eat easy on drinking and stop smoking. So smoking age a woman's ovary, especially when your age is also, you're older too, and it's also depletes your production of egg. So that's why it's just for a short time, just why you have to stop the smoking and also drinking. So just give it a break until you find what you're looking for. So my number 10 is be aware that as we age, our fertility decline. There's no doubt about that. As a woman gets older, your fertility decreases. So there is a decline in quality and quantity of egg that a woman produces. So there's also increase in risk of PCOS, fibroid, fallopian tube blockage, and endometriosis. You know what? Go back and check out my video on, I did a video on fallopian tube blockage. So check it out too, it's going to help. So as we age, all these things start to come out. So that's why the earlier we start thinking about babies, the better. So in conclusion, my advice for you is remember to make sure that not to stress out, everything is possible, and also believe in whichever being, God, whoever you believe on, and do your own part. My thing is, don't relax waiting for miracle to happen. Start doing something. Seek those medical attention. Oh guys, remember, I'm not a doctor. I'm just a nurse who is trying to get all those research information out for you guys. So please seek help from your doctor or your gynecology. It will also help. And guys, remember, I'm just keeping it real, and I love you guys. And remember, subscribe if you have not subscribed. I'm here to answer any question about pregnancy that you want to ask me. And I love you guys. Stay next week for another exciting topic. Mwah.